In our cover story, patients go to hospitals to get well. The last thing they want to worry about is their medication. They rely on the hospital to have a system in place to give the right medication at the right time. Difficult to read handwriting on prescriptions and similar names for different medicines are just a couple of the challenges hospital staff can face. Rod Starnes shows you how a quick scan can remedy those challenges.
Lynn Wilson was in Baptist Women's Hospital recently for a procedure. Over the course of her stay, nurses brought her medications several times, requiring specific instructions individualized to her care.
We have many steps that we have to go through in order to provide a medication to a patient. From the time that a physician writes that order until the time we actually give it, there's many opportunities for things to fail.
But Lynn was able to benefit from new technology. It's a barcoding system, similar to what stores use to scan prices on food and other products.
What barcode medication technology allows us to do is at the time that we're giving the medication is scan the patient's armband to verify that we've got the correct patient, and also verify each medication by scanning it to ensure that that medication matches that patient based on the physician's order.
The barcoding system is part of a multi-million-dollar investment at Baptist hospitals in Tennessee and Mississippi. Once a nurse scans the armband, the computer pulls up the patient's specific medication profile on screen and shows every medicine ordered by their physician and verified by the hospital pharmacist. It lets a nurse or respiratory therapist know that they're giving the right drug to the right patient at the right time.
Then finally, they'll scan the patient's armband again as a second double check to ensure that these meds that I've just scanned and that patient all match together, and then they administer the meds.
A study ordered by Congress showed that medication errors were happening to between 5 and 10% of patients admitted to hospitals. But follow-up studies show that using barcodes to track medications cut those types of errors dramatically.
I think it's reassuring as a patient. You feel as if you're getting the right medication at the right time. And I've often read and seen stories about mix-ups in medication in hospitals, and this is just a reassurance that it isn't happening to you.
Making sure patients get the right medication isn't the only use for the barcoding system. Baptist is also using it to protect their youngest patients. In the NICU, or Neonatal Intensive Care Unit, babies born underweight, early, or with other problems are struggling to survive. Making sure those infants get the right nutrition helps them get stronger.
Well, here at the Baptist Hospital for Women, we are also using the barcode technology to ensure that we give the right breast milk to the right baby.
Baptist is using the barcoding system to label containers of breast milk provided by moms. Studies show that matching milk to the right child substantially reduces risks to babies.
For most of our neonatal patients, their moms are no longer here in the hospital providing their feeding. Our nursing staff is doing that. And so each mom is provided with barcodes that match their baby. That barcode is applied to the container for the breast milk, and then when the nurse provides that feeding, they scan the baby's armband, scan the milk to ensure that it matches, and they're able to give that patient the nutrition that they need.
So while it may seem a little strange for patients to carry around the same kind of coating that's on a can of peas or other groceries, the peace of mind it provides makes it a process that patients like Lynn Wilson are happy to accept.
Just part of today's world, I think.
For Smart Medicine, I'm Rod Starnes.